We the OG family.
Which side? Pick a side, you decide. Team K, Team C. Welcome to the OG family. Yeah. Welcome to the OG family. Just smash that like button.
What's up, OG family? It's your boy Corey.
And it's your girl Kristen. And we the OG family. Hey. If you're new to the channel, go ahead and hit that subscribe button and join our giant family. If you're not new, hey boo, welcome back. Today is my pre-op appointment.
Turn right onto North Civic Center Plaza.
Okay, today is my 2-week post-op appointment. When you guys are seeing this, it means that I have made it out of surgery successfully.
And if you guys haven't seen this, that means she is gone.
What?
Oh my gosh! Don't say that.
I'm just playing.
Stop it. This is when they take my before pictures and we go over everything, all of my lab results. We go over just the surgical plan.
Yeah, so this video might be a little detailed, very detailed. So you guys stay tuned for that. We're gonna bring y'all along with us. So stay tuned, we're gonna be back, y'all.
Very excited.
Very excited. I'm not ready for the...
It's 2 weeks away. Now I'm so excited. It's right around the corner.
It's the healing position stuff for me.
Well, because you have to help me.
Yes, I have a weak stomach.
He does. But my sister will be.
Look like. I'm just gonna walk you through so we can, eliminate all nerves and jitters. Guaranteeing you your day. The surgery center will guarantee your time. So I don't want to tell you a time just now. But when one of the nurses call you, it will most likely will be Maya. She'll call you just to do another pre-op phone call with you. She will guarantee your check-in time, and then typically an hour of prep work. We'll get started in the OR. But yeah, so you'll meet your nurses. You remember Maya and Morgan, they're great. You'll see Dr.Repta again. He'll do his actual markings in the pre-op room. And then you'll meet the anesthesiologist as well. So he'll come in, just kind of get familiar with each other so you're comfortable, start your IV, get you hydrated, and get going. So yeah. Yes, Monday the 11th, March 11th, 2024, perfect. So yeah, give or take maybe 3-4 hours in the OR, then not including your recovery in the PACU. That could be 45 minutes, maybe up to an hour, depending on the patient.
So surgery time is like 3 to 4 hours?
Yes, give or take. So, but we'll of course be in contact with you or your mom if you choose to, and we'll let them know, like, hey, she's finishing up with surgery, she did great, you can meet us over in the sanctuary. You remember the sanctuary, that overnight suite. So we'll let you know when a good time to head back this way, and then you can...
I can't stay.
Like during surgery?
Mm-hmm.
If you wanted to, I guess. I'll see with the surgery center, because sometimes their waiting room is not really up and running because they don't have like a receptionist back there, so to say. But yeah, we'll play it by ear. I'll ask them today. When we go back over there, we can chat with them. But yeah, 3-4 hours, give or take. Then you'll recover and PACU, then go to sanctuaries, spend that night there. Again, I'll order you a meal tonight, whether it's from Panera or True Foods, wherever you'd like to eat from. So you'll have 2 nurses, they'll do a night shift and a day shift, so you'll meet with both of them. And if nobody's called you just yet, they'll probably call you next week, just introduce themselves, so you're comfortable with them. And yes, like I said, so you'll go through the night here. Next morning, again, arrive 6:30, just to go over discharge instructions. Dr. Repta will be here, of course, to check in on you, and then you'll be on your way. And then we'll see you at that 7-day post-op. Because again, you'll have 2 garments on. So you'll be in a binder wrapped around your full torso. You'll also be in a surgical vest. It just looks honestly like an oversized sports bra. But you're gonna wake up with that on, and we'll give you a second pair at your post-op, just so we can change out of the dirty ones, put you in clean ones. You can go home and wash the first pair. But again, you'll alternate between those 2, but ultimately you'll stay in those for a full 8 weeks. Yeah. You might have some lipo foam in there, so this is a thin layer of foam just to give you smooth, even compression all across the way. So he might, put some padding in there too. But yeah, we'll take a look at the drains, see how they're doing, change any dressing if we need to. All that will be done at your post-op, so you don't have to worry about anything at home besides resting, being comfortable, using the restroom. That's really all.
Does it hurt when the drains come out?
No, you really don't even feel it. 'Cause I can't say it's the same for everybody, of course. It may feel like a little slithery, little
Okay.
Like,
I was just
across you.
like, my thought process was like, oh my gosh, when the drains come out, he's gonna be like, all right, 1, 2, 3, yank.
No, it's fairly slow. 'Cause I mean, if you think about it, about this much is inside of you, like strategically placed, like, you know, he already put that in you, obviously not more before he sutures you. So there's a small incision, obviously with this port coming out of, or this cord. So like, you know, just like a small little dash, a little incision is made for this drain, just enough room for this drain cord to come out of. And then the rest of it, you know, he'll have this clipped onto you, and even like he'll safely put into your binder just so it's secure at your side, at your waist too. So, but I'll show you how to strip it, how to care for the drain. It's pretty easy, straightforward. You really don't have to do anything as far as cleaning it, you know, airing it out, anything like that. We really just want you, the biggest thing you're gonna do with this is just mark it down, your output on the little cheat sheet. Yeah, perfect. You mark that down, empty it, strip the drain, and then just hook it back onto your binder. So your first few days, you will have a lot of output. So be ready for that. Don't be alarmed by it. Of course, if you do have concerns, yes, you can always give us the call, but you will have a lot of output the first few days. So this will get full. If you get, you know, a small little dab on your binder, that's also okay. We'll probably just have you put gauze underneath it just to keep it, you know, have dry contact.
Okay. When I get out of surgery, he can come. Would my mom be able to like come see me too? Okay.
Oh yeah.
And then what time do they have to leave?
Usually it'd be like maybe 8, 9 p.m.
Oh, okay. See, that's not bad. Look at you. You can still chill with me.
Oh yeah.
And then she said, if you're
Cuddle up in bed.
So remember how I told you how I have those sponges for like washing?
Oh yeah. Face and body.
Yeah.
Cool.
Like for the pits and bits, pretty much.
Oh yeah, we talked about this.
It's
Okay,
right.
perfect.
So that's okay, right? My mom is scared that you guys are gonna be like infection, or as long as I don't get the incision, right?
Yeah, our biggest concern is obviously we just don't want you like submerging or anything, like especially like where the drain port is. We don't want you submerging your incision or getting that really wet. We just want dry, clean areas. So yeah, if you're washing underarms down there in that area, that's completely fine too.
Okay.
Yeah, your little sponge bathing is perfect.
Okay. And then after surgery, am I allowed to eat regular food?
Yeah, so no restrictions as far as after surgery goes. We're more so concerned about leading up to surgery. So 40 hours prior to surgery, again, it's in your booklet, so you'd be on a full liquid diet. It's really not that bad. It sounds a little bit worse, but so full liquid diet. I mean, you can have protein shakes, smoothies, anything really pureed, yogurt.
And that's the first 2 days before surgery?
Yeah, so 48 hours leading up to surgery.
Okay.
So let's say you're on a Monday, so yeah, I'd say
Saturday.
all day Saturday, all day Sunday, perfect. And obviously your cutoff is midnight, of course, so nothing to eat or drink past midnight. If you know, shower in the morning, brush your teeth, just obviously don't, just everything out, don't swallow. So, so yeah, regular diet, you can resume normal diet afterwards, so that's perfect.
Okay, yeah, that's all my questions.
Perfect. Another big key point is too, we'll have you shower the night before surgery and then shower the morning of surgery as well with an antibacterial soap. You know, most of my girls, their go-to is just Dial soap. It's cheap. You can obviously come into surgery with very comfortable clothing. Probably wouldn't recommend sneakers or anything that you have to bend over and tie. You can just slip something on. Slippers are great. Crocs are great.
Okay.
But yeah, you really, again, your first 2 weeks are super uneventful. We just have you resting in bed, or the recliner is really helpful too.
Yeah, that's what we have.
Okay, great. Yeah, easiest just to get in and out of. I would just line it with the chuck pads, those little puppy pee pads.
I got waterproof, like one of those covers that go over it, and then we have like puppy pads. Well, not puppy pads. They're like the baby.
Yeah.
We got
just
those.
for in case it gets soiled. But
Yeah.
that's perfect. And I was telling my guys, don't wear any article of clothing that you're in love with, that you'd be upset if it got soiled. I'm gonna just wear like anything.
So it's not like I'll just have like a vest. It's not going to be like a full faja.
No, it's not like a girdle or anything like that. So I'll show you. So again, your binder, it looks like a waist trainer. So it wraps around your full torso. It sits nice and low. Just to give you.
I went and got like actual fajas.
Like if you did like a fat transfer, if you did a Brazilian butt lift or even like a thigh lift, anything with the lower half, we would give you a girdle just because it offers the compression, usually from knees all the way up to your waist. So as you can see, it comes like nice and low down to your pubic area because again, we're going to lipo that area and also do your pubic lip. So you want to make sure that area is also compressed and covered by the garment. Obviously, you won't have like a gap or anything because this is just a surgical bra. We're giving you a vest. So it's going to meet with that binder just so everything is again, evenly compressed. Again, leg ball all the way up to right underneath your breast, underarms, all the way down to like your hip bone. So really it's a wide area that we're getting. But yeah, we'll bundle you up really well, put the lipofoam in, your drains will be in, and you'll be nice and snug. So that's what I say, let us do the work. So yeah, don't take anything off at home, don't take your binder off or anything. He'll do that when he sees you.
Okay, so you don't want me to check, because I got like extra foam pads and everything, like just in case. I'm like a real stickler on like yucky. Like,
I know, it's
yucky,
the first few weeks is really tough just because you can't shower until the drains come out. So I know it's really hard for some people. So like dry shampoo, I've never known anybody that's been comfortable to like go to the hairdresser and get a blowout, because just like their position, I'm like, I don't know if you'd even want to do that. So dry shampoo, the sponge bathing is pretty much like what we have to go off of until those drains come out. So again, maybe it's at that 3-week mark, it might even be at that 4-week mark. We know more in real time, so when we see you at your 7-day and your 14-day, etc.
Oh, so you guys see me like 7 days after?
Yeah, we'll see you once a week for the first like 4 or 5 weeks.
Oh.
You know, so we'll be on top.
I didn't. I thought it was gonna be like every 2 weeks or something like that.
Oh no, you won't get rid of us that way. So, no, we'll see you once a week. You'll come in office, and obviously, let's just say if we're a few months out, at that point, you can always do like a virtual follow-up. It will become less frequent at that point. All better. Yeah, girl. You'll get less frequent, obviously, down the line when you're in the clear and pretty much healed. But even at that point, even if you just want to jump on like a virtual call with him, we can just do like a phone call, a phone follow-up if you don't like want to make the drug out here. So yeah, your 6-month mark, you know what I mean? But yeah. So yeah, that binder and that vest I showed you. But yeah, don't take anything off. If you have stuff at home, that's great. Just put it to the side for now. So when you come in for your 7-day, he'll change out everything. He'll give you, additional lipofoam if it's needed, just to make sure everything's even.
Okay, so you know how I got those extra fajas and the extra foam pads? She said, we don't do that. We don't change it. So when I'm like, I feel gross, let's just change it. Remind me, they said, do not do it.
I'm not gonna want to, no way.
When you know me, I'll be like, I'll do it myself.
I'm like twist her, I'm like, all right, come on, you gotta help me out here. But no, we'll give her again 2 sets of garments. So when she wakes up from surgery, she'll already be in her vest and binder. Then we'll see her at her 7-day post-op. We'll give her a second pair. Dr. Repta is gonna change her out of the old dirty ones, put you in the new ones, and you'll feel so much better. And then yeah, just go home, wash the old pair, and then you can alternate between the two.
I'm like excited. I'm like in my mind as you're talking, I'm seeing myself. I can't wait.
You'll be so good. You should look at caretaker.
I thought I was excited. I don't know.
Are you getting scared now, or are you just?
Yeah, I'm getting scared.
I feel like after this appointment, though, it really does clear up like a lot of like, not frustration, but just a lot of any like I talked about like pre-jitters, any hesitation, things like that.
Yeah, just the drive home, I feel like I drive 25 miles per hour.
Well, because it's morning traffic. Everybody's going to work.
Great girl.
And then the bumps and all that stuff.
She's a lot more durable than you would think, though. It's not.
I'm gonna have those shots in my stomach, so.
Yeah, the Exparel shot will go into your muscles, so you'll be feeling real good.
Do you want my mom to pick me up in the morning, or do you want to pick me up in the morning?
I'm not gonna be able to do it, to be 100.
You just gonna be scared?
It's hell. And then I gotta take you out the car, and you gotta walk a certain way.
She might, yeah, I mean, she might just be a little more, but she definitely will be just a little bit more slow going. And like I said, I told her she's gonna be like hinged at the hip, so she's not gonna be all perky and happy.
Do you think I'm gonna be able to walk upstairs?
I wouldn't recommend going upstairs.
Okay, leave the chair downstairs.
Yeah, oh my gosh, look at you. He would tell you if you can keep everything on like just one level. So again, if you have like the recliner downstairs, cool, set a little bedside table with you, where you can have like your medications, anything that you really need that's in close proximity of you. Bathroom, if that's on the same floor, again, that's also great. That'll be helpful. Just because going up and down the stairs multiple times a day, he's not a fan of. So.
Oh no, I wasn't. We were gonna go. If I go upstairs one time, like after surgery, go upstairs, and then that's where I'm staying.
Yeah, that'll be home base.
Yeah. I had a bathroom thing where I gotta get help her go to the bathroom and all that.
I mean,
she can't get up by herself. True.
I would definitely assist her. Just because again, just having extra stability will be really important too. But I mean, that's why wearing just loose fitting clothing, like if you wore those muumuus are really helpful, or a robe. Obviously nothing like this t-shirt where you have to like pull over your head and no pants. I mean, if you wore like even something to like, sweatpants or something of his, just so it's easy to take off, because some Philly girls don't even wear underwear, and that's fine because again, your binder, your drain will be hanging out, so if you just want to like pull the sweatpants down.
Yeah, you might want to bring that.
Well, that's why I got the robes.
Yeah,
Because that's just all I plan on wearing.
Yeah,
It's just
you'll
that.
be fine with your garments on, and then like a robe or something over you just to keep warm and stuff. But yeah, going to the bathroom, again, it's not going to be a total challenge, but like I told him, just to have that extra stability, because even in the sanctuary, when you look at our bathrooms, like there's, areas to hold on to, like little, those bars too. But yeah, if you don't have that at home, obviously most people don't, then just.
Yes, and the bathroom upstairs, I can use the walls because it's smaller.
Yeah.
But you're not going upstairs.
But if she said if we go upstairs the day of surgery, then that's like where I stay. She said that's home base. You don't go up and down, up and down, up and down. So I'll have a bell and I'll, Jeeves, please bring me some water. And we've got the mini fridge and everything up there. Just stock it with the water, protein shakes.
Perfect. Lots of water. I left a little box of BioSteel in here, so those little powdered, not drinks, but the electrolytes. These ones are really good, so yeah, add these into your water too. So
Okay.
for after surgery, that's really ideal. So yeah, I have these with you.
You guys are so cute with the gifts.
Tissue paper, presentations, everything. Your binder's gonna come down nice and low, so when you're laying down, well, not laying down completely flat or just sitting, the binder's gonna want to keep riding up, so just make sure you keep shimming it down to your hips. Slightly lower. Just so the binder would come down. Okay, beautiful. Thank you. There. So again, about this much is inside of you, not that you're gonna feel it. I know it looks really gross, but it's not. So say that's placed in you, and then okay, you get up to use the restroom. So again, when we talk about stripping the drain, this is exactly what we mean. Because again, we want this to stay as clean as possible, as clear, so nothing gets clogged. So what we'll have you do is first hold it taut at your side, or just hold it against yourself, just because it's only held on with 1 or 2 stitches. So if you did give it a good pull, you might feel it. It's not gonna feel the best, so just TLC. So yeah, just hold it at your side, nice and secure, and then we'll tell you to pinch it with something lubricated. So maybe an alcohol wipe, a baby wipe, whatever you have handy, and you'll just pinch and pull down, pinch and pull down, pinch and pull down.
About how long is the surgery?
Around 4 hours, plus or minus 30 minutes.
Okay.
Yep. So 3-4 days before your surgery, lighter meals, a couple days before surgery, liquid diet, lots of water the day before your surgery, lots of water before you go to sleep, water, propelled Gatorade, something like that. Make sure you have a normal bowel function the day before your surgery.
Okay. Is it okay if I take a stool softener before surgery?
You can if you want to. Yeah, we just want you to go into surgery basically not having a lot of food processing through your GI tract.
Right.
For a couple of different reasons. After surgery, it's all about staying hydrated. So a few sips of water every 5 minutes, pee every hour.
Okay.
That should be your protocol after surgery. A few sips of water every 5 minutes, pee every hour. Okay.
Would it be okay to do just, how the 2 days before you stay on the liquid diet, is it okay if day after surgery we stick to that and we just do like the protein shakes and like smoothies?
It doesn't make any difference. The key, you don't have to eat after surgery. Your body doesn't have is not in like a need for like nutrition to build the healing process. The hydration is the most important part.
Okay.
Water, right? And so what I would do is I would take a bite out of like crackers or something light like that. Obviously drink some water, let that settle down in your stomach, then take whatever medication you're taking for pain.
Okay.
My recommendation for pain is really ibuprofen and Tylenol. We'll prescribe you, in fact I just said that, prescribe you a narcotic, but 90+% of our patients are able to do it with just ibuprofen and Tylenol.
Okay.
So I want you to take ibuprofen every 6 hours around the clock for the first week. If that takes care of it, you're done. If that doesn't, but almost, then you could add Tylenol on top of that.
Okay.
Because Tylenol is broken down by your liver, ibuprofen is broken down by your kidneys. So you can take them at the same time or stagger or however you want to do it.
Okay.
Okay.
I have one more question and my brain
That's
is...
okay, take your time.
So we have like sponge bath things that are like soap, but that it doesn't have to be like rinsed off for like your bits and your pits and stuff. That is okay as long as the incision is not wet, right?
So let me give you the bird's eye view of what's important, right? So we talked about the stuff before surgery, right? 4 days before, a couple days before, water, going to the bathroom, all that stuff. After surgery, the most important thing is water every 5 minutes, bathroom every hour. The next is probably keeping your garments on smooth and like appropriate, right? So they're not all bunched up and everything. The next is rest, okay? So psychologically and culturally, we want to like clean ourselves, right? But the reality is that our brain wants that, our body doesn't need it, right?
I don't want to be funky though.
It might, but remember, we're choosing to do a lot of different things in the name of healing and, you know, rapidity of results and all that stuff, right? I mean, you're having surgery and you're choosing not to work out for a while. You're having surgery and you're choosing not to like clean the house or get in and out of car and all that stuff, right? So it's the same thing. Do whatever you want to do for a sponge bath. Just keep your garments on nice and smooth.
Okay.
Right? Got it.
So don't take them off until you guys take them off.
Yeah, and then when you come in, we'll take those off. We'll give you a new pair, then you can alternate. You know, bring the clean, wash them, bring the clean ones in when you come in. For all that kind of stuff. The body wants those 4 things: hydration, compression, drainage. Don't drain, rest. It wants those 4 things. That's it.
Will I have 1 or 2 drinks?
1.
Okay.
Coming on the side.
Okay.
That's
cool
it.
because
So
I'm
the-
left-handed.
So that's what the body wants. The brain, of course, that's what the body needs. Of course, the brain may want a lot of different things, but we don't. We're gonna put the body before the brain.
Okay.
Okay. Should we have a look in there?
Yes,
Got
sir.
everybody stand right there. Tells me to do. You can kind of tell that it kind of wants to stop right there. If you want to let go for a second, it kind of wants to stop right there. This is more just volume, so we'll liposuction all of that.
Okay.
Okay. Now, obviously, is there some loose skin in the back? Yes, because we can see that part and we can see this part, but those don't change because we're not doing a back lift. I'll sneak it as far back as I can to liposuction it, but we're not doing anything with the skin on the back.
Okay.
Okay. So that incision goes.
So this will be gone?
Yeah, because we're going to liposuction it. But in terms of skin excision, we're removing this. We're going to make that incision from here to here, and then we're going to basically remove all the skin from here to here.
Okay.
And then we're going to liposuction all of that. So this is going to be liposuction.
Okay.
I'm just not removing any skin there because that's part of the back lift.
Okay.
Okay. And then I don't know whether you'll need a vertical, or not. We'll see that at the end. Right?
Okay.
Because what I'm trying to do is I'm trying to make your waist as narrow as possible, and as we do that, this might bulge out, and if it bulges out, then we have to do a vertical incision.
Okay.
If it heals great, doesn't take that much, doesn't take any longer to recuperate from that, doesn't cost anything, so might as well. Yeah. If you don't need it, I won't do it.
Is it harder to, is it more painful? No?
Nothing changes.
Okay.
That vertical changes, nothing changes. So okay, your drain will come out the side here. So
It'll be below, or will it be, it's just like right with the incision?
yeah, it'll be about half an inch below your incision.
Oh,
Yeah.
it's below the incision, not in the incision?
Well, if I bring it out through the incision, you mean like where it comes out?
Yeah, like is it going to like, okay, let's say the incision was right here.
Yes.
Is it going to be like in the incision, or is it going to be like, it's a different incision?
It's a small puncture wound, usually right below your incision.
Oh, okay.
And the reason for that is, I've tried it both ways. If you bring the drain tube through the incision, it leaks a lot around the drain tube. So it's pretty messy, you know? And so by bringing it through a little puncture wound, I can keep the puncture wound small, and it's like shrink wrapped around the drain so that fluid doesn't come out.
Gotcha.
That's better. Now, I've also done it where I do it through a puncture wound at the end of the incision. The problem is that sometimes then the drain goes way back here, and it's kind of a weird location, you know, you're like laying on it and stuff.
Oh, and does it kink?
Sometimes it kinks, sometimes it pushes on your skin a lot, so these are all the things that I've tried along the way, and I've learned that by just going a little bit below your incision, making a little puncture wound, that usually is the best.
Is it going to go through the front? Like, is it?
It goes
Okay.
all the way across.
Okay. Okay.
Yeah. And then gravity pulls all the fluid down, the drain pulls all the fluid out of there.
Gotcha.
Good. Your tattoo is not in danger of being impacted because even if we're doing a vertical incision, it would only be here. And then, of course, the horizontal one is only going to go down here. And obviously, as we're pulling down this way, it changes how the tattoo looks a little bit, like it kind of spreads it out a little bit.
My body has changed the way the tattoo looks. They were much smaller.
So unfortunately, as we go like this, see the distance gets bigger.
Yeah, that's
And as we go like this, it kind of gets, so the tattoo actually gets a little bigger. So.
They're never seen. I'm not worried about it. You could have cut them out and I've been okay with it.
Questions?
No. Do you have questions?
Good. Everything's going to turn out great. Just do the things that are important, right?
Yes.
So there's all these things that I can control in the operating room, and I will. You control the things that you can control after surgery.